Most people believe controlling blood pressure means one thing: medication for life. And honestly, no one ever told them otherwise. Not because there aren't other options, but because simple solutions don't get talked about. Here's what 20 years in cardiac surgery taught me. Your body already has a built-in pressure valve, a natural brake inside your nervous system, and you can activate it right now, sitting exactly where you are, using nothing but your breath. After 60, this isn't optional knowledge. It's essential, because once you understand how to use it, you stop feeling dependent on external control. Let's simplify something important. Your blood vessels are not rigid pipes. They are living tissue. They expand. They contract. They respond. When you're young, this happens easily. But with age, things change. The walls stiffen. Elasticity drops. Your heart has to push harder, and that shows up as higher numbers. That's the physical side. But there's another layer. Your nervous system, the part running in the background, controlling heart rate, vessel tension, stress response. And that system can push your pressure up just as much as the physical changes. Your nervous system has two modes. Think of it like driving a car. One is the accelerator, the sympathetic system, fight or flight. It tightens your blood vessels, speeds up your heart, raises pressure. The other is the brake, the parasympathetic system, rest and recovery. It relaxes your vessels, slows your heart, lowers pressure. Here's the problem. After 60, most people are stuck on the accelerator. Years of stress, poor sleep, constant low-level tension. All of it keeps that system active. And the brake? It gets weaker, unless you use it intentionally. Here's the part most people never realize. Your breath is directly connected to your nervous system. Every time you exhale slowly, longer than your inhale, you send a real signal to your brain. Not a metaphor, a physical signal through the vagus nerve. And that signal says, relax, stand down, we're safe. Your blood vessels respond immediately. They loosen, tension drops, blood flows more easily. Your heart doesn't have to push as hard. And all of this can begin within seconds. Think of your body like a hose. Stress tightens it. Breathing releases it. This isn't just a feeling. It's measurable biology. Let me show you the first technique. I've used this with many patients. One of them, a 8-year-old man, struggled with high evening blood pressure, even with medication. His readings stayed elevated, especially at night, which is very common after 60. I taught him this method. He was skeptical at first. Most people are. 3 weeks later, his evening pressure dropped by nearly 9 points. He was sleeping better, feeling calmer. Here's how you do it. Sit comfortably, feet flat on the floor. Inhale through your nose for 4 counts. Slow, steady. Then hold for 7 counts. This part helps your vessels relax. Then exhale slowly through your mouth for 8 counts. Long, controlled. That's 1 cycle. Repeat 4 times. It takes less than 2 minutes. Do it morning and evening, and especially before stressful moments. The second technique works differently. This isn't about quick relief. It's about retraining your system. Your heart naturally speeds up when you inhale and slows down when you exhale. That rhythm is called heart rate variability. Higher variability means your system is flexible and healthy. Lower variability is linked to higher blood pressure. Researchers found something interesting. When you breathe at 6 cycles per minute, your heart and lungs sync perfectly. That's where your system works best. So here's the method. Inhale for 5 seconds. Then exhale for 5 seconds. No pause. No force. Just a smooth rhythm. In for 5. Out for 5. Do this for 5 to 10 minutes. twice a day? At first, it feels slow, but your body adapts quickly. And over time, this creates a real shift in your baseline blood pressure. This next technique may look unusual. I'll be honest about that. The first time most people see it, they hesitate. But the science behind it is very real. Your left and right nostrils connect to different parts of your nervous system. Left side activates the calming response. Right side activates the alert response. When you alternate between them, you bring both systems back into balance. And when that balance returns, your blood vessels relax. Your pressure drops. Here's how to do it. Sit comfortably. Use your right hand. Close your right nostril. With your thumb, inhale through the left for 4 counts. Then switch. Close the left nostril. With your finger, exhale through the right for 4 counts. Then inhale through the right. Switch again and exhale through the left. That's 1 cycle. Repeat 6 to 8 times. It takes just a few minutes, and it's especially useful when your pressure spikes suddenly. Here's something I tell every patient. Don't rely on how you feel. Feelings can mislead you. Numbers don't. If you have a blood pressure monitor, use it. Sit quietly for 5 minutes. Take your reading. Write it down. Then do your breathing practice. Wait another 2 minutes. Measure again. Write that down too. Do this every day. For 2 weeks. Not occasionally. Consistently. Most people notice an immediate drop, but the real change shows up in your baseline over time. That's the number that matters. Now let's answer the obvious question. Does this actually work? Short answer, yes. Multiple studies have looked at this. Slow breathing practices have been shown to reduce systolic pressure by around 8 to 9 points on average. That's comparable to some first-line medications. Other research on alternate nostril breathing has shown reductions of up to 10 points, and larger reviews, covering dozens of studies, all point to the same conclusion. Controlled breathing activates your parasympathetic system, reduces stress hormones, relaxes blood vessels, and lowers resistance in circulation. These are measurable effects, not opinions, not trends. This is physiology. Here's where most advice fails. It tells you what to do, but not how to fit it into your day. So let's make this simple. Morning, before you even get out of bed, do 2 minutes of resonance breathing. In for 5, out for 5. That's it. Later in the day, when you naturally sit down, do 4 cycles of the 4-7-8 method. Takes less than 2 minutes. And when stress hits, because it will, that's when you use alternate nostril breathing. 3 techniques, 3 different moments. No session longer than 10 minutes. What matters is consistency, not perfection. I've spent years in operating rooms, holding human hearts in my hands, seeing what uncontrolled pressure does. Over time, the damage builds slowly. Scarring, stiffness, loss of flexibility. But here's what still surprises me. Even after all of that, one of the most powerful tools is not a drug. It's not a procedure. It's understanding that your body isn't broken. It's just been stuck in the wrong mode for too long. Your nervous system already knows how to regulate. You just have to activate it. And every small drop in your numbers is real protection. Let's bring this together. 3 techniques, 3 simple tools. The 4-7-8 method for daily reset. Resonance breathing for long-term balance. Alternate nostril breathing for sudden pressure spikes. Now, here's what I want you to do. Try one today. Measure your pressure before and after. See the difference. And tell me, which one worked best for you? Leave it in the comments. And if someone you care about is dealing with blood pressure, share this with them. Because understanding this can change everything.